Has some special winter tires just for you.
Yeah, you know what? It's science. Tires in the winter on your car need to have that softer compound, and that's what the winter tires from Big O Tires are going to get you. It's proven. You can actually get better grip on the road, and you will be safer in those Big O tires. And you can save $70 instantly right now at your local Big O Tires on select sets of in-stock winter tires. So you have no excuse. You got to be safer on the road. Go to your local Big O Tires.
Yes, there's 42 locations from Logan to Beaver. And of course, Big O has no credit needed financing. No matter your situation, no matter your budget, they can take care of you. So don't let it deter you from getting the tires you need.
It's not just the tires either. How about getting that oil change there, the brakes, the shocks, the struts on your car, the alignment? They have the free alignments as well. The batteries, the wiper blades, all of it. Trust Big O Tires with your car, getting you ready for winter. Big O Tires. Tell them Scott and Alex sent you. Big O Tires, the team you trust.
There are only 13 states that tax Social Security income. And unfortunately, Utah is one of them. That means you could get double taxed on your Social Security income, leaving you with a lot less money to spend in retirement. Learn how you could avoid this double tax with a free Social Security analysis from Boss Retirement Solutions, winner of Utah's Best of State Award for retirement planning. If you've saved at least $200,000 and have not filed for Social Security, be one of the first 10 callers to schedule your free analysis now at 801-682-4448. Learn how you could avoid getting double taxed on Social Security. Call 801-682-4448. 801-682-4448.
Advisory services offered through Boss Retirement Advisors, an SEC-registered investment advisory firm. Insurance products and services offered through Boss Retirement Solutions.
Brent, another satisfied Whipple Service Champions client, left this review. We purchased a 1950s home. In the inspection, the wiring was found to be done improperly. Prior to starting the repairs with Whipple, we talked through each of the line items so the price was understood. When the job was complete, Whipple showed us the parts that had been improperly installed by the previous owners, and it was all done the same day. Now we know our house is safe and secure. Thanks, Todd, John, and the Whipple team. Need a plumbing, heating, air conditioning, or electrical repair? Call the 9 times Best of State winners, Whipple Service Champions, and take $100 off any repair or replacement of $300 or more. Get any drain cleared, just $55. Gerber Viper, ADA compliant, comfort height. It's 4 inches taller, it's elongated, and it's only $399 installed. Get $350 off any electrical meter or panel replacement. Water heater flush, $39. Tankless water heater flush, just $79.
Whipple, they come, plumbing troubles all gone.
Ask Brent for emergencies. When he called that day, we came that day.
Traffic and weather together, brought to you by Mountain America's free online and mobile banking tools. It's Katie Kia in the traffic center.
A heads up for drivers heading eastbound on I-80 towards Kimball Junction. The freeway right now down to just 2 lanes, the 2 right-hand lanes. Left-hand lanes currently closed, so move over to the right side as you approach Park City. I-15 right now at freeway speeds with no major crashes or slowdowns to report. If you're heading from Ogden into the downtown area, it's about a 35-minute drive. Experience Altitude, a higher level of customer service with personalized financial guidance to help your business grow. Now at Alta Bank, altabank.com. Katie Kia in the KSL Traffic Center.
Just a slight chance of more snow showers today. We'll top out around 40. Warm up a little bit as the week goes on, but another storm coming around on Friday. We'll keep eyes on that for you. Right now in Salt Lake City on the freezing mark, 32 degrees with plenty of clouds at KSL Newsradio, 102.7 FM, 1160 AM, and KSLNewsRadio.com. This is Utah's all-day companion for news.
The coronavirus, the Utah response, in-depth coverage on KSL News Radio.
Oh, I'm so excited for the next several minutes. In fact, jump on KSL News Radio's Facebook page. You can watch this interview live on KSL News Radio's Facebook page. We have been diving into the news that Pfizer's vaccine is reportedly 90% effective. And it's really all been leading up to this moment. We're talking now to the state's Immunization Director. His name is Rich Lakin. He's helping lead the COVID-19 vaccine distribution here in Utah, Dave.
Yeah, and what is that going to look like? We've been punched in the face a million times in 2020. Just one thing after another. It's hard to be optimistic. But right now, Deb, I'm euphoric. We've been dealing with these imperfect solutions, whether it's masks or social distancing. Like right now, we have to avoid our family and friends, like they have the cooties. But a vaccine, that is the game changer. And I'm excited to learn more about it. So let's bring on Rich Lakin. He's the Immunization Director with the Utah Department of Health. Rich, thank you so much. You probably had a little inside track on a lot of this information, but for us, when we heard a 90% effectiveness in this vaccine, I mean, I didn't do a dance because I'm a terrible dancer, but kind of wanted to. Were you surprised?
Yeah, I think you heard probably about the same time I did when they announced it. But a 90%, if that is a true factor, that is huge. I mean, that is a very significant mark in a vaccine that is safe and effective. And so, we should all be excited about it because that really could make a difference in this pandemic.
My understanding is Pfizer will meet with the FDA next week in seeking emergency approval. So give us an idea. If they get this emergency approval, when will they start trucking the vaccine to Utah, Rich?
So what they're going to do is about mid-November is that we are going to probably see that vaccine, that Pfizer vaccine, into 5 hospitals that have ultra cold capacity. And they will store it. They will put it in their ultra cold freezers, and they will hold it there until ACIP recommendations, which is one of the big milestones. They're not going to approve this vaccine until ACIP makes their final recommendations. That's a bunch of volunteer physicians that are on this, and they look at the data, ensure that it's safe and effective. And then they, once that approval happens, then we'll get the okay, and the vaccine will already be at these 5 hospitals, and they won't have to wait for the shipment. They can just start vaccinating their staff.
Rich, I'm a little confused. They developed all these vaccines in advance with just the hope or the faith that they would work. Is that the idea?
Yeah. So a lot of these companies are putting millions of dollars into the idea that, hey, our vaccine will be approved, and they are running a risk because if they produce all these vaccines, and if there's something wrong and ACIP doesn't make the recommendation, then the vaccine is not going to be sent out to the general public. And so I think I don't know how it runs at that level at the pharmaceutical companies that they do this, but I'm sure they have preliminary people that look at the data early in the vaccine and say, you know what, we got something here that will work. Let's take a chance and let's spend the money and let's do it. And because if we can get a vaccine out earlier, then we can reduce this pandemic at a sooner pace.
We have so many questions. In fact, several questions coming in from our listeners, reminding our Facebook family who's watching and also our listeners who are listening via radio or Alexa that this is Rich Lakin. He's the Immunization Director with the Utah Department of Health. One of our listeners wants to know how long these immunizations will last. Will we have to get them every year like we do the flu shot?
Yeah, we don't know that yet. What will happen is once that approval, that will be part of the data set that they are reviewing to see if they can determine how long this vaccine, the immunity will stay within an individual. We don't know that yet. Still learning, but when it comes to the vaccine, they'll have a good idea, and that's part of the approval process. Is they want to know how long this vaccine, somebody's immune system, how long is that going to last? And we'll know more once the vaccine is actually released.
Practically speaking, what's it going to look like? Do we go to the pharmacy? Do we go to our doctor? Or do we have to go to specific hospitals to get this?
So we have set up in our distribution plan, we have set up in a number of phases. And those 5 hospitals that I discussed earlier that received the vaccine, those are the 5 hospitals that see the most COVID patients. So they have the highest burden. So that's why they're receiving the vaccine in the beginning, so that they can, once it's cleared, they can vaccinate their healthcare workers. As we move through the different months, January will continue, and that will probably most likely, sorry, let me back up. That'll be most likely in December when those hospitals, the first or second week of December, when those hospitals can start vaccinating. And then as we move through January, we continue to add more hospitals, and then we continue to add long-term care staff. And then as we move into February, we add more long-term care facilities, skilled nursing facilities. And then as we move into March, we continue to add additional population. So like in March and April, we're into more people with underlying medical conditions, those that age 65 and older. And then once we get into the May, June, and definitely probably the July timeframe, that's when all of the Utahns can receive it. And by that point in July, all of our partners, so your private physician, your clinics, all of the pharmacies, everybody should have some vaccine, and that's where they can go to get it. And we're hoping, again, and the thing that I stress is that vaccine will drive the response. So if we have enough vaccine, we can move through populations faster. If we are limited on vaccine, then we're obviously going to have to do it more strategically.
Rich, before we let you go, some of our listeners are wanting to know, will this vaccine be required for kids to return to schools in the fall?
No, it will not be required for them to return in the fall. We do not know the age group yet for these, for the vaccines. For me to make a determination, I would say that this vaccine right now will probably be for 18 and older, and it probably won't be for kids in schools. But again, we don't know what the vaccine has been approved for, what age groups yet.
Is that because that's because kids typically don't have the same severe symptoms that older, adults and maybe some people in their 20s and 30s are having? Or is that because we just don't know how safe the vaccine is for children yet?
So it depends on what populations they did for the clinical trials. If kids were not added to those clinical trials age groups, so let's just say 2 to 16 years of age, if they were not part of the clinical trials, then they will not be included because the vaccine was not given to them and they will not have data to ensure that it's safe for them.
Rich, thank you so much for joining us. We're going to go a little long because I got to get this other question in. We've been talking about this vaccine. Are there other vaccines that are close that would, again, help ease the burden and maybe get more people immunized quickly?
Yeah, that's a great question. So there is one more vaccine that is probably only about a month behind Pfizer, and that's the Moderna vaccine. And that one looks like, so the Pfizer vaccine comes out about the first or second week of December. Moderna is about a month behind.
Perfect. Rich Lakin, thank you so much for joining us. He's the Immunization Director with the Utah Department of Health. Incredible information. Thank you so much for joining us. And Debbie, I think we're going to break this down a little bit in the next segment because there was so much really good information that Mr. Lakin gave us.
Yes, we appreciate our Facebook audience. We're getting a lot of questions. Producer Andrew Hull talking in my ear with those questions. Let's see if we can dive deeper into what we just learned and also take your phone calls. Let's have a roundtable discussion. Some say the vaccine, this is a game changer. It's a miracle. Some say it's too soon. Share your top worry about this with us. 801-575-TALK. 801-575-TALK. Back with your phone calls straight ahead.
Dave and Dujanovic.
This is Tim and Amanda.
We report on the news until 9. Then Dave and Dujanovic talk about the news.
We hope they've become a favorite source of information on KSL Newsradio,
Utah's all-day companion for news. Amanda and I just love to talk about our friends at UCCU, and one of the reasons why is really the unique culture and the dedication that they've had through their entire existence, Amanda, of putting people over profits. That starts with something as simple as a low interest rate.
What is the rate on your credit card? Do you know? You ought to find out, because if it's not 6.75%, and I bet it's not, you need to get a UCCU credit card. Their credit card is 6.75% variable APR. Is that a terrific rate, Tim, or what?
Yeah, and it makes it so easy to not just purchase things on the card, but transfer higher interest balances from other lenders. And by the way, that's free. Here's the other thing. No annual fees, no other surprises. UCCU has you in mind. They're all about helping people make smart financial decisions.
It's like Josh from Spanish Fork says, I always know I'm getting the lowest rate when I work with UCCU. They have my back.
It only takes a few minutes to complete an online loan application at uccu.com.
UCCU, love where you bank.
Now at Siegel Book, America has deep-seated roots of faith planted by pilgrims seeking religious independence. Discover best-selling author historian Timothy Ballard's book, The Pilgrim Hypothesis, uncovering what early colonists, a people who believe themselves to be the new Israel, may have known about their role in the restoration of the gospel. Just $17.99 at Siegel Book. And celebrate the holidays with a timeless marble Christus, 3-inch, just $4.99. Serving you in store, curbside, by phone, or at siegelbook.com.
Does your insurance agent treat you like family?
Insurance Corporation is programmed to build interpersonal relationships with members of family units. We communicate on a 4-name basis with all customer numbers.
Only a human who knows you can create a plan that's right for you. That's why for 80 years, Farm Bureau Financial Services has built relationships first and plans second. It's your future. Let's protect it. Talk to a Farm Bureau agent today or visit alversusagent.com.
The holidays are right around the corner, and you're thinking it's time to lose those extra unwanted pounds that have crept on during COVID. For the entire month of November, Skinny Utah is offering a buy one program and get a second one at half price. Grab your spouse or a friend and get ready to feel better. Get healthy and lose 20 pounds in the next 40 days with Skinny Utah. Skinny Utah has 3 convenient offices in Draper, Orem, and Centerville. Everything is 100% natural, no drugs or hormones, no prepackaged meals to buy, and customized for you specifically. You can choose an in-person consultation or a video call, whichever's easiest for you. Skinny Utah is following all PPE practices by wearing masks and disinfecting after each client to keep you safe. Visit skinnyutah.com to schedule your free consultation. Look your best. Feel your best. Visit skinnyutah.com. You have nothing to lose but the weight. That's skinnyutah.com.
Hey, I'm Andy. If you don't know me, it's probably because I'm not famous. But I did start a men's grooming company called Harry's. The idea for Harry's came out of a frustrating experience I had buying razor blades. Most brands were overpriced, overdesigned, and out of touch. At Harry's, our approach is simple. Here's our secret. We make sharp, durable blades and sell them at honest prices for as low as $2 each. We care about quality so much that we do some crazy things, like buy a world-class German blade factory. Obsessing over every detail means we're confident in offering a 100% quality guarantee. Millions of guys have already made the switch to Harry's, so thank you if you're one of them. And if you're not, we hope you give us a try with this special offer. Get a Harry's starter set with a 5-blade razor, weighted handle, shave gel, and a travel cover, all for just $3 plus free shipping. Just go to harrys.com and enter 7750 at checkout. That's harrys.com, code 7750. Enjoy.
Download the KSL News Radio app, powered by Any Hour Services.
With the 3 things you need to know this hour, I'm Tim Hughes. First, former Utah Governor Mike Leavitt says it's time for the Trump administration to begin the transition of powers. Leavitt spoke on MSNBC yesterday, saying this is a very significant part of the way we preserve democracy. Second, a group of protesters outside the governor's mansion yesterday say that Gary Herbert's mandates are government overreach. They believe no one should tell them who they can associate with in their own homes. And third, United Airlines is adding 1,400 more flights the week of Thanksgiving. Travel experts say despite rising COVID-19 cases, people are taking to the skies in record numbers since March. We'll look for a high today of 40, just a slight chance of showers. It's 32 downtown. Back to David Dujanovic on KSL Newsradio.
The coronavirus, the Utah response, in-depth coverage on KSL Newsradio.
I think this is huge news. We just heard from Rich Lakin, who's in charge of Utah's immunization distribution. Dave, it sounds like the first wave of COVID-19 vaccines could be arriving in Utah in the next couple of days, and it'll be stored at hospitals. And then once the company gets emergency approval from the FDA, they'll start immunizing staff.
In December. Debbie, we're talking about immunizations in December. That's incredible. And this is the Pfizer product, but there's one from Moderna that's going to come about a month after that. So this is not just a one single hope. This is, there's at least 2, And across the world, there are many, many other vaccines that are already being used. I know there's a couple in Russia, some in China, all over the world. Pharmaceutical companies are working on this and this only.
We're still live on Facebook with our viewers there. We know we had a number of viewers tuning in to watch our conversation live when Rich Lakin dialed in to Facebook Live and also called into the show. He's the Immunizations Director with the Utah Department of Health. He's going to be very busy over the next few months. He broke it down basically saying that this is going to happen very soon, which I think is very, very exciting. Let's listen into what he said.
About mid-November is that we are going to probably see that vaccine, that Pfizer vaccine, into 5 hospitals that have ultra cold capacity, and they will store it. They will put it in their ultra cold freezers, and they will hold it there until ACIP recommendations, which is one of the big milestones. Not going to approve this vaccine until ACIP makes their final recommendations.
If you're wondering what ultra cold freezers are, this has to be stored at, what was it, Deb? Negative
94 degrees.
Negative 94. Yeah, so ultra cold, that is certainly not my freezer. But this is huge. This gives me a great deal of hope. And this isn't just the light at the end of the tunnel. The train has arrived. We're just waiting to get on. And I mean, the speed of which this vaccine was created is dumbfounding to me. It was produced 4 times faster than the mumps vaccine. And that was the fastest in history. That took 4 years, Debbie. The fastest vaccine in history took 4 years. We'll have it in under 1.
What we don't know is long-term side effects from the vaccine yet.
Yeah.
We don't know. They say that could take a couple of years. We do know that some of the side effects immediately known to the trial, those who participated in the trial, were things like, you feel achy, you have a little bit of a fever, but they were closely monitored during this trial. I don't know how that's going to work once we start distributing it to the broader population in Utah. But Rich Lakin went into that with us because we wanted to know, well, we've been using the example of the average Joe all morning long. When does the average Joe get it? When do just, people who don't have underlying conditions, are not 65 years and older, don't work for the hospital, aren't first responders, how does that timeline work? So let's listen in and to what how Rich broke it down for us on a month-by-month timeline.
Most likely in December, when those hospitals, the first or second week of December, when those hospitals can start vaccinating. And then as we move through January, we continue to add more hospitals. And then we continue to add long-term care staff. And then as we move into February, we add more long-term care facilities, skilled nursing facilities. And then as we move into March, we continue to add additional population. So like in March and April, we're into more people with underlying medical conditions, those that age 65 and older. And then once we get into the May, June, and definitely probably the July timeframe, that's when all of the Utahns can receive it.
And Debbie, this is the Pfizer vaccine, but Moderna, which is about a month behind, according to Rich Lakin, they said they'll have 20 million doses ready by the end of the year and 500 million by 2021. So this is going to cut down the timeline even more so. We think, you're saying the average Joe, you and I, when we will get the vaccine, we're looking at probably June or July. Well, if you put another company in there with more vaccines, that just speeds up the entire timeline.
I'm also looking at this new approval from the FDA. We're just getting one approval after the other. More hopeful news after more hopeful news. They approved the monoclonal antibody drug, Dave. They approved the monoclonal antibody drug. You remember when the president was in the hospital? He got that.
Yes.
And remember, he just sprung out of bed and walking around like he never had COVID.
It was incredible.
But that was part of his treatment.
Yeah, he went into the hospital on Friday, and 5 days later, he was symptom-free. And he hits that at-risk category. Age, health conditions, and to see him respond so well. This has been what's so difficult about the entire pandemic. is we haven't had a treatment and we didn't have a vaccine. That's why we've had to go to such extremes when it comes to mask wearing and social distancing. Like right now, we can only hang out with people that live in our house. It's because we don't have treatments. We don't have vaccines. Well, these are not just on the horizon. They are arriving this month in just a few days.
Now, I know from what I've read, the monoclonal antibody, which could honestly reduce hospital stays for people who are admitted to the hospital, because you get this antibody and it starts fighting the virus. But it won't be for, it'll only be for people 12 or older. Now, on the flip side of that, when we're talking about the vaccine, we just heard from Rich Lakin, the vaccine guru for Utah, who said he doesn't think the vaccine is going to be for people under 18 because if that age group was not included in the trial, then they can't just start injecting kids with this. Because I asked him, will kids need to have this vaccine before they head back to school in the fall? Will it be required? And how can you require it if they don't have trials saying it's safe?
Yeah, and that's very, very standard when it comes to vaccines. They always test it out on the adults because there's just so many more adults, age groups. There's not a lot of kids. And really, they got to focus on the adults first, and then they can worry about the kids. But again, we have learned a lot about this virus over the last 10 months. And one of the biggest is the younger you are, the less you are affected by it.
I also want to remind our Facebook family, as well as our listeners, that we're going to have Cass Ho. She spent weeks in the hospital. She's going to call in at 10:35 because she's getting her medical bills now. And she's going to reveal for us how much those bills are. And it's mind-boggling. And straight ahead, Vice President-elect Joe Biden promising to heal the nation. Can he? And how? Boyd Matheson with his take at 10:05.
Live breaking news, now on the mobile app for KSL News Radio. Listen at home or anywhere you go. Brought to you by Any Hour Services. KSL FM Midvale, KSL Salt Lake City, KSL News Radio. This is Utah's news station.